We hadn't planned, our government is sleeping.
कितने मजिस्ट्रेट जुडिशियल मजिस्ट्रेट मर गए.
This is a very serious offence.
You are confident at this moment that the oxygen production capacity has been ramped up enough. Give us specific figures to ensure that every single person in this country who needs oxygen will have that oxygen available when he needs it.
Only about 15% of the oxygen that was produced in the past was used in the hospitals. That was only about 700 tons per day during the pre-COVID times. Currently, that 700 tons per day has gone up to just over 7,000 tons a day. Whereas India's manufacturing capacity has also increased from 7,200 tons a day to about 9,200 tons a day. Rahul, manufacturing oxygen is easy, but delivering the oxygen to the patient is hard. There are only 70 manufacturing locations across India, but as you're well aware that the demand for oxygen is all across the nation. So this is a huge supply chain challenge in front of us, and the government has taken all sorts of initiatives using the Air Force, the Navy, the rail, special corridors. The oxygen molecules exist in India. It's getting it to the point of consumption in the right time, which is a huge challenge. So the largest quantity of oxygen that is available in excess currently on surplus is in Eastern India, whereas the least number of cases are in those states, primarily Jharkhand and Orissa. So you have to move this product from Jharkhand and Orissa about 1,500 kilometers to the point of use, which is in North India. Currently, less than 10% of India's oxygen is manufactured in the north, but a significant demand comes from there.
Do you fear the worst, and what according to you is the biggest challenge in rural Uttar Pradesh today?
जिस प्रकार से हम लोग टेस्ट की डिस्क्रिपेंसी देख रहे हैं, बहुत सारे लोग कोविड हैं लेकिन टेस्ट नेगेटिव आ रहे हैं, ये शहरों से भी अछूता नहीं है. तो ऐसे में मैं ये जरूर कहूंगा कि हम लोगों को लक्षणों को देखते ही हम लोग ट्रीटमेंट को एज अर्ली एज पॉसिबल अगर हम इंट्रोड्यूस करेंगे तो निश्चित ही इस वेव में जो हमारी जानें जा रही हैं तो उसको मिनिमाइज कर पाएंगे.
In the first wave, it took 4 to 6 months for traveling the infection. Now within 1 month it has reached practically every village. My rough observation is that nearly 10% of rural population is today sick with symptoms, which means probably much larger number of people are infected. There are deaths reported from large number of villages. So our count is definitely undercount of deaths and of cases. True problem is much larger, and it is because for the past 70 years we neglected developing public healthcare system. Past 30 years public healthcare system is underfunded. But then this government had at least 1 year's very clear warning. But we did not prepare for that.
What we are now seeing in rural India, has it been caught napping unawares? We thought this disease will not spread into rural India. Do you think that's the problem?
We never cared about rural India even earlier. We were building, we have AIMS and other facilities we still have in the cities, but in rural areas, we have invested very little or next to nothing in the primary healthcare system. And that's where rural India lives. Rural India doesn't even come to district hospitals. So we have totally neglected the primary healthcare sector. We don't have doctors in the villages. We depend on ASHAs. ASHAs are the ones in March also were doing everything that needed to be done, who are unpaid, incentivized workers. And what have we done to them? We've exhausted them. We haven't paid them. We have a large number of ASHAs who are sick, who we have not taken care of. We never gave PPEs or any protection kits to our frontline health workers. How are you expecting right now that they will be able to deal with people dying, people not having any oxygen in a primary healthcare center is a rare commodity. We hadn't thought at all, we hadn't planned, our government is sleeping.
If some businessmen, they were importing oxygen concentrators and selling it, perhaps at an undue profit online,
What's wrong with it, sir?
This enterprise is covered by Prevention of Black Marketing and Maintenance of Supply of Essential Commodities Act 1980, and also covered by the Disaster Management Act, Profiteering, Epidemic Diseases Act, and the Indian Penal Code also. I mean, if I were to go on and on, it is not a healthy and a straightforward business practice. It is profiteering at its worst.
Making a killing in these times is actually a crime against humanity. Do you agree with this?
This is a very serious offense because this is an essential commodity today in shortage, and today the government is struggling with the availability of such a material, in fact, and lives are being saved. Few profiteering elements who are actually involved in this should be brought to books.
There have been multiple raids this past week, and hundreds of concentrators have been recovered. Should all of them not be sent to different government hospitals? Or, in your appreciation, is it okay for a Delhi court to allot some or to give some to Delhi police and to judicial officers who are battling COVID, sir?
नहीं, इस आदेश में हम किसी ढंग का कोई फॉल्ट नहीं पा सकते हैं, किसी ढंग की कोई गलती नहीं है। कितने मजिस्ट्रेट, जुडिशियल मजिस्ट्रेट मर गए ट्रीटमेंट के अभाव में, ऑक्सीजन सिलेंडर के अभाव में। ऑक्सीजन की कमी है, वेंटिलेटर्स की कमी है, लेकिन किसी सरकार का कोई ध्यान नहीं है। वकीलों के लिए अगर हमें स्पेशल नहीं है तो कम से कम इम्पोर्टेंट जरूर है। पिछले 12-13 महीने से हम भी कोरोना वॉरियर्स की तरह जनता की सेवा कर रहे हैं।
Normally, this kind of property is to be kept in the malkhana,
yes,
and not put to any use. The choice was either to let it rot in the malkhana or put it to some use. Now, in the wisdom of the judge, if he felt that if it is given to certain people whom he feels that could preserve the case property for being used later on whenever it is called for.
Yes.
So if he is giving it to certain officials, police or the judiciary, he knows instead of being just locked and not being used, it is being used and can be recovered again as and when it is required for the purposes of the adjudication of the case. So I don't see anything wrong